Hello everybody, this is our study titled The Comparison of the Resection Site Order in Simultaneous Approach of Colorectal Liver Metastasis, and it goes by the short name of CORSICO Study. This study is being developed at the HPV and Robotic Research Unit of the Hospital of Alessandria in Italy, under the direction of Professor Fabrizio Panaro. I am Gabriela Delangel, I'm one of the leaders of the project. I am an HPV surgeon graduated from the Latin American program of the American HPVA. Currently, I'm a fellow in robotic HPV surgery in the same hospital in Italy. The rationale for creating this study is that 25% of the patients with colorectal cancer will have liver metastasis at the time of diagnosis. In some specific scenarios, a simultaneous approach is feasible, and this could benefit in terms of cost and avoiding the patient suffering. But the question is, during the simultaneous approach, is there a difference on what stage to do initially? If we do liver stage primary, we will maintain the sterility and minimize the potential infectious morbidity. But if we do the colon stage primary, we will avoid the bowel wall edema and prioritize the resection of the primary tumor. Currently, there is only one study in Asia exploring this question, and instead of what was expected, postoperative outcomes were worse when performing primary liver stage initially during the simultaneous approach. But when they analyzed the oncological outcomes, resecting the liver first was associated with better results. In conclusion, the primary liver stage during a simultaneous approach is associated to worse postoperative outcomes, but the primary colon stage initially during the simultaneous approach is associated to worse oncological outcomes. So, the aim of our study is to assess whether the order site of resection in a simultaneous approach for colorectal liver metastasis influences the postoperative outcomes, comparing the primary liver stage versus the primary colon stage during the simultaneous approach. Secondary, compare the oncological outcomes such as overall survival, disease-free survival, and recurrence sites between both approaches, and assess the outcomes of each order site resection when this was performed via open, laparoscopic, or robotic surgery. It is designed as a multicentric international study with an estimated sample of 500 patients. We invite all centers with more than 10 cases of simultaneous approach in the period of study to enroll their patients who have been operated of simultaneous approach for colorectal cancer and liver metastasis, whether it was performed by open surgery or minimally invasive techniques, between the years of 2015 and 2023. It is important to mention that these patients must not have the extrahepatic metastatic disease at the time of the diagnosis or at the time of the surgery. And this is a brief timeline of the steps of the study. We are currently inviting centers, and we will be collecting data from January to March of next year, eventually do the data analysis and the publication of the results. This study has been approved by our Institutional Review Board, and it is designed according to international ethical standards. And it has also received the endorsement of the European Federation International Society for Digestive Surgery, who we really appreciate their support on the promotion of this study. So I hope you find interesting our study, and if you want to participate and enroll your patients, this is our emails from the study, and greetings to everybody.